Since no two patients are the same, Iyashi Care works with the patient and their loved ones to understand what types of support would best meet their needs and preferences.
It is almost always very customized to that person's needs. We have to know your situation in order for us to explain what we can do for you.
Iyashi Care provides various patient services.
We would do a goals of care conversation on the very first visit to see what's most important to the patient, what's their preference of how to proceed with the treatment, and how we can best help them going forward. I might ask, what is important for you if your disease progresses? And some might say, being independent is important. When I'm no longer independent, I don't want to continue treatment, and that's their choice. It's very important that we have this conversation early on so that the doctor and the family are prepared.
Anyone who is 18 years or older should have Advanced Healthcare Directive. The document lets your family and the physicians that are treating you know about your wishes when or in case you can't speak for yourself.
Symptom management will be important. It could be pain, nausea, or constipation. And I would check if there's any medication causing that. Is it possible to eliminate it? And if not, then make some recommendation as to what medicines to use. It's really a team effort.
I tried to talk to Yanami, so this patient tried this and still doesn't work. And then is there any way we could give medication or any other suggestions?
When we get the referral, we try to get some information from the current team so that we try to help what the family needs, make sure that the patient doesn't feel like there's multiple doctors giving conflicting advice, and will be just additional support, help family feel that everything is overseen in a big picture.
Most of our patients don't ask the questions to doctors and then come home and say, oh, I don't know what the doctor said. Dr. Yanami can provide additional explanation to what the doctor said or a certain lab result in their language.
In addition to the patient, Iyashi Care also offers support and services to their loved ones who are caring for them.
I give resources for caregivers, but I also do education. And then you will most likely need this type of resources when this happens or when your loved one needs this level of care. The patients speak Japanese, but their adult children don't speak fluent Japanese. There's often some misunderstanding. That's where we can facilitate the communication. Oh, that's what bacha means, or oh, that's what it means. Sometimes caregiving can bring up a lot of issues among the families, and that's normal. In that case, we can facilitate the discussion with family members to really focus on what's most important for the patient and how we can care for that person. Many family members often wonder what they're doing is right. The decisions that they made was the correct ones. For those caregivers, we will give them validation, tell them that they're doing their best and their feelings are normal. A lot of times the families and patients thank us for just being there and listen to them.
They always ask about me, how I'm doing, that I'm being cared for as well.
Additionally, Iyashi Care also provides the following services: 24/7 telephone support, emotional and spiritual support, home safety evaluation, referrals to hospice if needed, and more. Iyashi Care offers community-based palliative care for Japanese and Japanese American older adults with serious or chronic illnesses. The program can serve patients from the time of diagnosis. Iyashi Care is available to patients who live in Los Angeles and Orange County, and with limited services to those in Ventura County.